Good morning, and thank you so much to the organisers for inviting me to speak today. My only regret is that I cannot be with you in person. My name is Dr. Elly Hiby, and I am the Director of the ICAM Coalition. I wanted to start with a very quick introduction to ICAM. We are a coalition of international charities, and our mission is to support the development of humane and effective dog population and cat population management globally. We publish joint guidance documents. Here a selection of 3 of those. We run conferences and webinars. All the presentations from our 2024 conference are available on our website as videos. We also host free online courses. The one that may be particularly relevant for this audience will be our DPM for Policymakers course. And finally, we also develop tools. The one example here is Talea, which means count in Latin, which is an app designed for conducting street surveys of free-roaming dogs and cats. I'm going to focus this presentation on rabies control, why culling is an ineffective choice and what we can do instead. Let's start with a couple of examples of historical rabies control from within Indonesia. First, Flores, where an outbreak in 1997 in East Flores led to culling of 70% of the dog population. Such a high percentage was achieved through several methods, including forcing owners to kill their own dogs. Despite this high percentage, rabies spread across the island and became endemic. And more recently in Bali, again an outbreak followed by a culling response of an estimated 100,000 dogs, about 25% of the total dog population on the island. There was also some vaccination effort in the initial outbreak response, but only of dogs brought by owners to a central point and using a locally produced vaccine with low efficacy. Again, the virus spread across the island and is still present today. In both cases, the reason for the spread was the same. Many dogs are valued and people don't want them culled, and so they move them to safer places, taking the virus with them, a human behaviour that is very difficult to change. You may be thinking, of course she's presenting evidence that culling doesn't work. She comes from the animal welfare sector. But let's now look at what the World Health Organization says. Their mission is to save people's lives, not animals. And yet they say removal of dogs does not decrease dog density or control rabies in the long term. Mass culling of dogs should therefore not be part of a rabies control strategy. It is ineffective and may be counterproductive to vaccination programs, particularly where they target free-roaming dogs. So I think it's fair to ask, why does culling not work? What are the mechanisms? So here we are using R0, once a concept known only to epidemiologists, but thanks to COVID, now known to everyone. We know that we have 3 factors that we can influence with our interventions in order to bring R, the effective reproduction number, below 1 and as close to 0 as possible. The faster we can do that, the faster to elimination of rabies from the dog population. So we're working with transmissibility, contact rates, and duration of infection of rabies in dogs. So let's now look at the tools we have available to us to influence these 3 factors. First, we have the oldest tool, stamping out, to reduce contact rates. If you're talking to someone with an animal health background, this tool will be somewhere in their mind. This is complete elimination of all infected and susceptible animals, usually done when the animals are all contained and accessible, for example, animals on a farm. But impossible to achieve with dogs. You just can't access enough of the dog population. Note also that it does nothing to transmissibility or duration of infection. The usual culling response is in reality what attempts to stamp out become. It's the culling of all accessible dogs, but not all dogs. Think back to the Flores and Bali examples. Again, no impact on transmissibility or duration of infection, and the impact on contact rates varies. You may get a transient reduction in contact rates if you work really hard on your culling, but you often don't. Dogs are social animals and they continue to search each other out even if they have to travel a bit further to do so. And as already mentioned, people may start to move their dogs to avoid culling teams, in effect increasing contact rates. The behaviour of dogs with rabies symptoms is also relevant. Some will be capable of moving long distances before the disease takes over and then they die. And then we have the mechanism of population rebound. Rates of replacement following culling can be remarkably rapid, and the resulting populations are skewed towards younger animals that are likely unvaccinated and therefore rabies susceptible, so you're actually making the situation worse. That dogs replenish their numbers so quickly following culls surprises some authorities who expected their culling efforts to lead to longer lasting impacts. But evolution has selected for behaviours and biological mechanisms that support animals to compensate for peaks in mortality, usually caused by disease or predation, but in this case as a result of culling. And together this leads to the finding that rabies is independent of dog density. It persists with a fairly consistent R0 across a wide range of densities. So what are our other tools? We have vaccination, which reduces transmissibility and duration of infection. In fact, it brings the time of infectiveness down to 0 because the dog's immune system kills the rabies virus without the virus having the opportunity to infect another animal or person. And the vaccines we have available are highly efficacious and relatively low cost. And then we have sterilisation, which on its own does nothing to transmissibility or duration of infection, but can potentially reduce contact rates if we think about breeding behaviours, but its main benefit comes in supporting vaccination as a disease control tool. The principal mechanism by which it does this is by reducing turnover. So in this graph, we see the proportion of vaccinated dogs rocket up during a vaccination campaign above that critical herd immunity where the rabies virus can no longer persist as there are just not enough susceptible dogs for the virus to hide in, and then slowly drift down over the coming months as vaccinated dogs die and new susceptible puppies are born, before being boosted back up by the next vaccination campaign. In effect, what we can do with sterilisation is to make this fall in vaccination coverage more shallow, ensuring it doesn't fall below that critical herd immunity, making our vaccination campaigns more effective and long-lasting. Now, I also want to show you this line. Now, this is what can be achieved for a free-roaming dog population, not with annual mass vaccination, but with all year round catch, neuter, vaccinate and return. You can bring the proportion of vaccinated and sterilised dogs up over a period of time, and if you keep maintaining your CMVR effort, you can keep the population at this level, well above critical herd immunity. Before I introduce 2 case studies, I want to ensure that we have a shared understanding of comprehensive dog population management, DPM. I've talked about sterilisation so far, but controlling reproduction is just one part of DPM. DPM needs to be perceived as a permanent system of services that are both working on the symptom of the current free-roaming dogs, mitigating risks and nuisance, but also to address the cause by working out where these dogs came from in the first place and working to stem that source, which is very likely to include the owned dog population. When we look at the dog population as a whole, as this system of interconnected subpopulations, we can start to see what population dynamic processes need to be addressed. So when I say comprehensive, I mean the DPM services match the dynamics that are a priority in that population. And this may differ not just between countries, but between communities within countries, varying between urban and rural communities and those with different religious and economic backgrounds. So if loss and failure to reunite is a significant source of free-roaming dogs, then we want to introduce identification and registration. If we find evidence of impulse acquisition or the sale of puppies with poor health and behaviour leading to subsequent abandonment, then we need controls on commercial breeding and sale. But of course, the most persistent dynamic process will be birth, and specifically for population management, unwanted births. Our goal is not to eliminate the entire dog population, is to create balance in the number and type of dogs that are born with what is wanted and manageable. Many countries invest in systems for reuniting and rehoming. This measure can be effective if there is a realistic chance of rehoming the dogs and if there are funds available to run these to a reasonable standard. But without the ability to build a widespread practice of rehoming, shelters become sanctuaries where dogs live out their lives, so they quickly fill to capacity and cannot take in new dogs, so they're no longer functional in terms of managing new unwanted dogs. And without sufficient funding, the welfare standards can become very poor indeed. In both cases, the financial resources required are sizable. CMVR is an option for managing free-roaming dogs in situ on the street, hence an alternative for shelters, steadily bringing their population down in size and mitigating the risks and nuisance these may present to local communities. I'm conscious that was a high-speed run through DPM. We do have two texts that cover this subject in more detail. Firstly, Chapter 7.7 from WOA's Terrestrial Animal Health Code, and then ICAM's DPM guide that presents very similar concepts but goes into more implementation depth. And then also that free online course accessible through our website, designed to be short and concise for policymakers. Bangkok is my first case study of DPM. This city has seen a decline in the free-roaming dog density by over 50% over 7 years, using CMVR implemented by Soy Dog Foundation and other DPM services run by local government. They've seen an associated improvement in dog welfare, and via a recent attitude survey, Bangkok citizens reported a reduction in nuisance behaviours and bites. There's also been a reduction in rabies cases, but this is not due to the change in density. Instead, the contribution of these DPM efforts to rabies control was through supporting that intervention of dog vaccination. The second case study I wanted to share is from Bali. This is a DPM solution run at the village level by the village community itself. So the project builds the knowledge and skills of community representatives in vaccination for rabies control, surveillance, and what effective bite treatment should involve. Also in animal welfare and what owners need to be practicing in order to achieve good welfare for their dogs, and how to help the community engage in safe interactions with dogs. These representatives are then responsible for mapping and monitoring their dog population, organising the delivery of animal health services, and delivering education to schools and dog owners. They're also on call to deal quickly and accurately to concerns including suspect rabies cases. I was involved in the evaluation of a pilot project in Bali, and the impact of this work was really clear. They saw improved animal welfare, reduced unwanted dogs, reduced bites, and reduced rabies cases in both animals and people. And because this involved capacity building of the communities themselves, these programs are much more sustainable than those that rely on outsiders. On to challenges now. One challenge to effective rabies control is accessing the right dogs for vaccination. These are the dogs that are most epidemiologically relevant to rabies control. So we know that free-roaming dogs are the most at risk of being involved in rabies transmission, and also create the best possible buffer to rabies spread if vaccinated. But the likelihood that dogs will be vaccinated tends to go in the opposite direction. Dogs that are fully confined, owned and adult are more likely to be brought for vaccination, whilst free-roaming, unowned and puppies are underrepresented. But these are the dogs that are the focus of DPM, both because they are the target group for intervention, and also because effective DPM will over time reduce the proportion of the population that is free-roaming, unowned and young, increasing the proportion of the population that is easily accessible for vaccination via owners or carers in the case of community dogs. Another challenge is when policies work in opposition to rabies control efforts. So one policy area that needs to be used with care is regulations on dog ownership. We do want to encourage responsible ownership, but if we bring in draconian measures and expectations, high registration costs or demands for chaining and caging at all times, we risk alienating the owners of those free-roaming dogs that would have been so precious to vaccinate because of their importance as a buffer to rabies spread. If these regulations are not realistic or they're unkind to dogs, these dogs will either be abandoned or they'll be hidden during those rare moments of enforcement, both of which make them less accessible for vaccination. These regulations need to have a clear outcome in mind, working with owners to promote best possible dog care, respecting what is realistic for the owner and what is kind for the dogs. Remember, it's not free roaming behaviour of dogs that is the problem, it's lack of vaccination. So we want owners to vaccinate all their dogs every year and to invest in basic care to support their survival by increasing value of a vaccinated dog. Too often public awareness materials demonise dogs with photos of scary looking dogs, all teeth and saliva. The motivation for these is to encourage important health seeking behaviour. Although I would like to challenge the effectiveness of such imagery, with many people simply turning away rather than absorbing the bite treatment messages intended. Images like these are far more likely to encourage the public to take action to vaccinate dogs and to care for them subsequently to protect that investment in their immunity. For effective rabies control, we need to create the ideal dog population, where epidemiologically relevant dogs are accessed for vaccination, vaccinated dogs survive, and the birth of susceptible puppies is minimised. We want to reduce population turnover. We want those dogs we have invested in with vaccination to survive, so we can make the most of the immunity we've given them. So quite simply, do not cull free roaming dogs and do not remove them to either relocate or housing sanctuaries. I've worked in a city where a nationally funded and led rabies control intervention was creating good vaccination coverage, only to find the city authorities removed those same vaccinated dogs just weeks later. We need cohesion, synergy between the national rabies control actions and DPM by local government. Reproduction control is a core service of DPM, but as a limited resource, we do need to use it wisely. We can identify which dogs are most likely to produce puppies that will remain unvaccinated. Community dogs are particularly relevant. They are free roaming, so at highest risk of transmission. They are provided resources by the public, so the puppies have a reasonable chance of survival, and so sterilisation and vaccination of these dogs through CNVR can be a powerful part of building sustained herd immunity. But also consider those dogs that are owned by people who are most likely to find themselves overwhelmed, like this lady that I met in the south of Thailand earlier this year. We want every dog to have oversight by an owner or a guardian that is willing and able to access rabies vaccination every year. When they have a couple of dogs, that may be feasible, but an unwanted litter can make that 8, and then the following year it's 14 dogs and she'd reached around 20. So very quickly people become overwhelmed, and the care provided to each individual dog drops off, including vaccination. Many of these owners know that, and they're willing to invest in sterilisation if it was accessible. So we need veterinary training in high quality sterilisation to ensure it's safe and quick, and mobile clinics or transport services to increase access to veterinary services. It's also most efficient to focus on females, as they are the limiting factor when it comes to puppy production. What I've done so far is pull out those elements of DPM that are most relevant to use when we are working on rabies control. But I don't want to misrepresent DPM. It's not just for the purpose of rabies control. There are a suite of additional impacts achieved through effective and humane DPM, and this is a key point. People with a laser focus on rabies may ask, why can't I just stick to vaccination and ignore the costs and efforts of DPM? And that is an option. But the reality is that DPM is wanted for other reasons, to achieve other objectives. In my experience working with local and national governments, rarely are their concerns purely on reducing rabies deaths. They want to see the rest of this happen. And so for those of us with a focus on rabies control, we need to welcome the addition of DPM and ensure that it does indeed have synergy with our goal of sustained herd immunity. So in summary, we have many tools in animal health, but when it comes to rabies, both the lessons of history and an understanding of epidemiology and ecology drive us towards the tool of dog vaccination as the most effective approach. DPM is a comprehensive and permanent system of services that mitigates the risks of the current free roaming population, but it also needs to work comprehensively to stem the source of future free roaming dogs. DPM has many impacts, including its contribution to rabies control, most clearly in its support of reaching and sustaining vaccination coverage, and not through its impact on dog density. But it has many other beneficial impacts, so we can find both stakeholders and funding for DPM that is in addition to that focused on rabies. Our job is to ensure those DPM efforts have synergy with what we are trying to do to control rabies, so we can maximise their contribution and prevent practices that run in opposition. Thank you again for inviting me, and thank you for your time in listening, and I very much wish you the best for the remainder of this conference. If you do have any questions, please do contact me via email. Best wishes.